We welcome in a very important person. Dr. Scott Davidson is medical director for Bronson Trauma Surgery Services and the Level 1 Trauma Center. Dr. Davidson, thanks for joining us today. I know how busy you are, and we appreciate you taking some time out.
It's great to be here. Thanks for having me.
So let me ask you, what's so special about this time of year?
Well, this is a week that we look forward to all year long because this being our National EMS Week, we finally get to give a little bit more attention and a shout out, if you will, to our first responders. That would be our public safety officers, our firemen, our paramedics, our EMTs, our air ambulance nurses and paramedics, and they just do a tremendous job. And I think we need to understand in this part of the state that this doesn't happen automatically. This happens because of a tremendous amount of dedication on the behalf of all of these professionals.
Dr. Davidson, this also is National Trauma Awareness Month, and obviously we're very honored here to have Bronson as a Level 1 Trauma Center, and you as the medical director. One of the things that there's kind of a river or a theme that runs through this. It's interesting. It's a 3D trauma prevention, but actually, if you look at it, it's kind of like 4D. Can you explain those to us?
Well, yeah, that's just trying to, again, focus on areas where we can really make a difference, and so much of what I see and what we see here at Bronson could be preventable. And so when you look at reasons that people get into mainly automobile accidents, but all kinds of other accidents as well, it often focuses around drugs, drinking, distraction, and drowsiness, and that would be your 4Ds. And we see that not only on the highways, but we also see it in the workplace. We see it during recreation. So any of these things can really impair your ability to respond appropriately and lead to an outcome where you end up in my hospital in the middle of the night, and we'd rather not see that. So trying to get out, get the word out, and trying to, as your grandmother said, an ounce of prevention can go a long way. So that's one of the things we're working on right now.
Dr. Scott Davidson is the medical director of the Bronson Trauma Surgery Services and a Level 1 Trauma Center there at Bronson Hospital. It's an interesting kind of a juxtaposition, Dr. Davidson, because we're looking at National Trauma Awareness Month and, of course, National EMS Week. And this is also, they're starting to crack down on seatbelt awareness as well. And I imagine you'd like to see that number up around 98%, close to 100% again, because obviously it's been proven that seatbelt usage does prevent serious injury and death in motor vehicle accidents.
Yep, seatbelt usage is still a key part of being safe behind the wheel. We actually occasionally hear about some folks who think that because they have an airbag, they don't need a seatbelt, and that's not true at all. You need the seatbelt to keep you in the right position for the airbag to be effective. So you really want to take use of anything that you have in your car to keep you safe, and that big thing is the seatbelt.
Well, let's go back to the 4Ds that we were talking about, 3D trauma prevention. Can you give us some ways that we can help prevent car accidents where we can be the person or the persons that help prevent that type of situation from happening?
Well, certainly, I think that not just the driver, but the people that are with the driver. So if you're a passenger and you think that the person driving the car is just too tired or is trying too hard to answer a page, I think it's up to you for your own safety and the safety and well-being of other people in the car and the other folks on the road, is to intervene and say, hey, why don't you pull over and let's switch drivers, or why don't you put the phone away or let me handle the phone. All very, very important things. And, it's to the point now where the American College of Surgeons doesn't call motor vehicle collisions accidents anymore. We call them crashes or collisions, and part of that is because it's almost uniformly explainable. It's not just a bizarre accident. There's a reason behind these collisions, and they are almost always preventable on some level.
Dr. Davidson, is there a place on the internet, a place online that people can get more information about, maybe National EMS Week, what's going on at the Level 1 Trauma Center at Bronson?
Sure. We do have a website, bronsonhealth.com/trauma, or you can actually send us an email at trauma@bronsonhg.org. So there are, and if you can get to our website, like I said, the bronsonhealth.com, you can pretty much get to where you need by following the links. And I think it's a good website and can give you some good clues on how to be safe.
Well, Dr. Davidson, I would imagine that, I mean, any time of year is a good time of year to make sure that you're safe and sound and whatnot. But as we get close to the Memorial Day weekend holiday and the unofficial start to summer and whatnot, people probably should be paying more attention, not just to driving, but boating and other things that they're doing so that they can make it a safe and happy summer.
Absolutely. You're right on the mark there.
Dr. Scott Davidson is the medical director of Bronson Trauma Surgery Services, Level 1 Trauma Center. Dr. Davidson, we know how busy you are. Thank you so much for taking time out of your packed day. We appreciate it very much, and we should tell you, hopefully you won't have to exercise your skills too much during National Trauma Awareness Month.
Thank you very much. Nice to be here again. Appreciate
Thank you,
it.
sir. We appreciate it very much. Dr. Scott Davidson of Bronson.